microwave, warmed up my shrimp fried rice, went to sit, like literally get in squat position and sit on the couch so that I could eat my Chinese food. And I feel this I heard a pop and I feel this gush of warm fluid. And I was like, okay, what was that? Like, it freaked me out. It scared the crap out of me. So I was like, oh shoot, my water must have broken. Hey guys, it is your girl, Chandra, aka Nurse Channie, and look where I am. Look, the lighting is good. My background is my normal background. I'm home. So I'm so super excited to be home for the weekend. So I came home this weekend because over the last week, both of my children celebrated their birthdays. Unfortunately, I wasn't able to come home for my daughter's birthday because I was in orientation, and I'm so bummed about that because it was my first time in her whole life that I had not seen her on her birthday. But through technology, I was able to FaceTime her. So that was great. Not the same as being here, but it was great. And then on today, my youngest, my son, celebrated his 18th birthday. So y'all, I don't have no more babies no more. Like, no more babies. How exciting is that? Yes. Oh my God. So I've been a mom for 26 years. 26 years, that's a long time. And I love being a mom. Obviously, it's one of the greatest blessings in my life. I love my children, but I'm telling you right now, I'm so excited that this part of motherhood is over. I'm always going to be a mom for my kids, always going to be there for them 100%. But when I say that I'm excited, it's because the day-to-day mom stuff that I've had to do for the last 26 years, those things I can remove from my plate. So I don't know what this new journey in motherhood looks like, but I know I'm pretty darn excited about it, okay? So it's so befitting that in today's video, I want to talk about my own personal birth story. So if you guys don't know, my name is Chandra, aka Nurse Channie, here on the Know It All Nurse channel. And I have been a maternal child nurse for the last 11 years. It's the only specialty I've ever worked in terms of bedside nursing. I've done a little bit of case management, but in terms of hands-on patient care, moms, babies, pregnant women, infants, that's what I know, okay? So I wanted to tell my birth story, and I wanted to talk a little bit about how my nurse influenced my decision to go into this specialty. So if you want to hear my birth story, keep watching. Okay, so as I told you, I have 2 children, but I specifically want to talk about when I had my daughter, which was my first time delivering a baby, okay? So just to give you a little bit of a backstory, when I had my daughter, I was a teenage parent. So I got pregnant at 17, had my daughter when I was 18. I got pregnant in my first semester of college. Yeah, it happens. I had a pretty uncomplicated pregnancy, but again, I was a teenager, and the pregnancy went well up until 37 weeks and some change. So with pregnancy, we know you're pregnant for 40 weeks, 10 months. So I got to 37 weeks, and I remember going to a doctor's appointment, and it was a Thursday. I remember this like it was yesterday. Went to an appointment on a Thursday. My doctor said to me, your blood pressure is high, and we're going to put you on bed rest for the remainder of your pregnancy. Now, I'm like, okay, I got 2 more weeks to go. Bed rest? Like, what does that mean? And as a teenager, I really didn't take it seriously. And my doctors, to be honest, really did not do a good job of explaining to me what kind of complication really me and my baby could be experiencing, okay? So, if you know anything about high blood pressure in pregnancy, or even if you don't, I'm going to quickly explain it so that you can understand it. So I'm going to try not to use a lot of big words, okay? So, pregnancy induced hypertension is when your blood pressure starts to elevate as a result of being pregnant. That's the cause of it. So it's not really your family history or that you have a history of high blood pressure, which you can have those things, which could further compound your issues. But this is specifically high blood pressure that is a result of your pregnancy. And the things that can start to happen to you when you experience high blood pressure as a result of pregnancy are typically the patient is going to complain of a headache that doesn't go away even though you've taken Tylenol for it, because of course women can only safely take Tylenol when they're pregnant for pain. Swelling in your hands, your face, or your feet. You may start to have shortness of breath. You may start to get a pain across the top of your belly. You might start to have some visual blurred vision or vision loss. You may have ringing in your ears. So those are some of the things that women can experience with high blood pressure related to pregnancy. And women who are younger, like teenage moms, or on the other side of that, women who are older, what we call advanced maternal age, can be the ones that are the most affected by this. It can happen to anyone, but most of the time you see it in our younger population and our older population, okay? So that is pregnancy-induced hypertension. You see all of those things that I just explained to you guys? My doctor did not explain any of that to me. What he said was, your blood pressure is high. We're going to put you on bed rest for the remainder of your pregnancy. And to me as a teenager, I didn't take it seriously. I came home. I remember telling my mom, my doctor said my blood pressure is high. And I think she said something like, you know how blood pressure runs in our family. So I remember coming home that day, I rested. My doctor said rest as much as possible. You can get up and go to the bathroom. You can make a meal, but otherwise we want you in the bed. So think about when you're a young person, 17, 18, 19 years old, you don't want to lay in the bed. So I didn't. And so Thursday I did rest. Friday, I kind of sat around and did nothing, if I can recall. So Saturday night, my girlfriend, one of my best girlfriends, my daughter's godmother, and her boyfriend came to visit me. So they were like, we're hungry. Let's get some Chinese food. So I said, well, I'm going to walk with y'all to get the Chinese food. So I walked. Now, the Chinese food place was probably maybe, I don't know, 5-6 blocks away, but you had to walk there and walk back. So I did that, and I never got any symptoms that I recall. I didn't have a headache, no extra swelling. Like, I didn't feel any different. And with high blood pressure, you don't typically feel different. But in my teenage mind, I was like, I don't feel any difference. I'm going to go get this Chinese food. So I did. And I hung out with my friends that night, and everything was just regular. Well, the next morning, I woke up and I remember feeling lots and lots of movement in my belly. And I was like, this baby, because I didn't know what my daughter was. She was a surprise. So I'm like, this baby is so active today. I don't know what's going on, but it's like she was like, boom, boom, boom. She was really, really active. And I paid it no mind. And then somewhere around 11:30, 11:45, I went and I said, oh, I'm going to warm up my Chinese food from last night. I had some shrimp fried rice. So I went to the microwave, warmed up my shrimp fried rice, went to sit, like literally get in squat position and sit on the couch so that I could eat my Chinese food. And I feel this big, I heard a pop. and I feel this gush of warm fluid, and I was like, okay, what was that? Like, it freaked me out. It scared the crap out of me. So I was like, oh shoot, my water must have broken. And so I wasn't having any contractions, no pain. I just wanted to eat my Chinese food, and then my water broke. And so I was home by myself, and this is the time before everybody had a cell phone, and my mom didn't have a cell phone. So as soon as she got in the house, y'all, it was like a scene out of Teen Mom. If you ever watch Teen Mom and the girls are home alone, as soon as their mom comes in, they're like, Mom, my water broke. That's how it was. I'm upstairs in the bathroom because this fluid just keeps coming out, and I don't know what to do with it. And I yelled down the steps as soon as I heard my mother's key hit the door. I'm like, Ma, my water broke. And she was like, okay. So my mom, she is no good in a panic situation. So she's like, did you call your doctor? I'm like, no. So I called the hospital, tell them that my water broke. Of course, they tell me come in. So, you know, oftentimes women with their first baby, if you've never experienced your water breaking, women come into the hospital and they're like, I'm here because I think my water broke. And sometimes it really is not that your water broke. It's just you have extra vaginal fluids as your pregnancy progresses toward the end. Sometimes you're peeing on yourself and you don't know it because all of that pressure. But for me, my water actually was broken. So when I got to the hospital, they were like, okay, so you're going to stay. And I was full term by this time, because now this is Sunday, and I was 38 weeks. And so they get me admitted and everything, and I really wasn't having a lot of pain at all. Like on the way over to the hospital, I started having some contractions, but I feel like they were just like period cramps, like nothing that I had never experienced before. So I'm thinking, okay, this is contractions, I can handle this. And I went in, they got me settled, you know, got me an IV, put me in my room. My daughter's father was there. So I remember them telling my daughter's grandmother, her father's mother, you know, her water just broke. It's her first baby. It was around 12 something in the afternoon. They said she probably won't deliver until like 8 o'clock tonight, if that soon. So everybody was just kind of camping out. It was just me and my daughter's father in the delivery suite or what have you, wherever I was. And I was just laboring. And the contractions started to get pretty bad. So I remember my doctor coming in saying, do you want some pain medicine? So, y'all, I am afraid of needles, okay? Not so much anymore, but I don't like needles. And I don't like needles to the point where I didn't want an epidural because I was afraid of getting a needle in my back, which I've never had an epidural. However, I have been there and seen many of them placed, and I have had patients who were in a great deal of pain. Once they got that epidural, they seemed to be very relaxed. But I've never had one, okay? So I said, no, I don't want the epidural. So they offered me some medication that I could get via an injection, a shot. So I said, okay. So my doctor offered me that, and I said, I'll take it. So my nurse was in the room. So my doctor told my nurse, give her, you know, I wrote an order for her to have medication for pain. And what they gave back then was Demerol, which is a narcotic pain medication, and something else. I don't remember exactly what it was, but I know one of them was Demerol. So he told her, I wrote the order, give it to her. So while I'm waiting, I started to become sick, and I started to get nauseous, and I sat up, and you know how when you're feeling nauseous, you know, you feel like you're going to throw up, and it's like, oh, I need to get to the bathroom, or I need to get something to a trash can or something so that I can throw up. So I started feeling nauseous, and I went and sat on the side of the bed, and I threw up all over the place. My nurse was pissed. You hear me? She was pissed. So here I am, this young teenage girl in here having a baby, and my nurse was not nice to me at all. When I tell y'all she was so mean to me, she was like, you just threw up. I wish you would have told me you were going to do that. So I'm tearful now. I just vomited and I got throw up all over me. I'm in pain and I'm just like, I didn't know that I couldn't make it to the bathroom. And she was just scolding me. I mean, she was just like, I wish you would have told me. Now I got to clean this up. Meanwhile, I'm still having contractions and I haven't received the pain medication that my doctor came in so sweetly like, do you want pain medicine? And I'm like, yes, because now these contractions are starting to kick in like a big dog. So she proceeded to go ahead and clean all of that up, give me a new gown to clean up, yet she never gave me my pain medicine. So I am very uncomfortable at this point. And my doctor came back and he's like, you're still having pain? Did you get your pain medicine? And I'm like, no, she didn't give it to me. So he yelled at the nurse and he was like, I wrote this order for her and I told you to give her pain medicine. Give her her pain medicine. Like, what are you doing? So finally, she eventually gave me the pain medicine. And because I had never had any kind of medication like that, it knocked me out. So I went to sleep and I don't know how long I was asleep. So this is the time frame that we're looking at. My water broke somewhere around 11:30. I got to the hospital somewhere around 12:30. My daughter was born at 4:06 p.m. So this is like 5 hours from the time my water broke. My first baby. That's how quick she was born. But I slept off of that pain medication and I woke up and my doctor was like, it's time. And I was like, time for what? Like, I'm waking up dazed and confused. Like, time for what? I don't even know where I am because that medication had me knocked out. So he said it was time to have your baby. So that's what I did. I had a baby. Back then, you labored in one room and then they took you to like this very sterile, I remember it being a very bright, I'm almost wondering, now that I think about it, I'm almost wondering if I delivered in an operating room because they were moving pretty quickly. So I don't know. I just wonder if my baby was not doing well and they decided to deliver me in an operating room. I don't know. I do know that they transferred me to another room because nowadays, most of the time you labor and deliver in one room and then after you recover, you're moved to the postpartum unit. Typically, that's how it is in hospitals that I've worked in. But back then, you labored in one room and they moved you to another room to deliver. I had my daughter in maybe 4 or 5 pushes. She came out and she was perfectly fine. It was my little girl. Had the baby. They took me to the recovery area and I recovered and then I went to the maternity suites. So as I got to the maternity suites, again, they were not very nice at all. It was like the nurses were very routine about doing everything they had to do with the baby. I remember being separated from my baby a lot. I was kind of like by myself in this room, and actually back then, you shared a room with somebody else. So I'm in this room with this other girl who had a baby, and we're both just in there like, oh, hey girl, hey. And I kept calling to the nursery like, I want to see my baby. When will y'all bring her? And it would be hours would go by where I would be separated from my baby. And so really, nowadays, the way that we practice, at least where I'm from, the way that we practice, we do a lot of family-centered care. And we try not to separate the mom and the baby if possible at all, like even in a C-section, and even for moms who deliver vaginally. We try to keep the baby with the mom as much as possible. So I know different regions practice differently. Some hospitals still have a separate nursery care and separate postpartum care. But here, for the most part, here in Maryland, the hospitals that I have worked at, we try not to separate mom and baby. And I just feel like my nurses were not very caring. I don't ever recall anyone asking me how I was feeling, how I was doing. Like, also back then when I had my daughter, you stayed in the hospital for 24 hours for a routine delivery. And so, like I said, I had a quick delivery, had her at 4:06 on Sunday. By 12 o'clock Monday, they were like, okay, see ya. Nice to know you. Congratulations. Take you and your new little baby home. And I was just like, whoa. Now, here I am, this teenage girl, new baby, been in the hospital less than 24 hours. Nobody really taught me how to take care of my newborn. Like, when I work postpartumly, I do so much teaching with my patients, like so much teaching, breastfeeding education, bottle feeding, how to care for yourself after having a baby. Like, I feel like I go overboard with the teaching. But child, they sent me home with this baby and was like, we're going to have a nurse call you to follow up with you in 24 hours. And I was just like, okay. That was that. And so when I became a nurse and I had the opportunity to experience my OB clinical rotation when I was in nursing school, I just became excited about pregnant women and about being there for people who are experiencing birth and labor and all that good stuff. And so I was like, this is what I want to do, because I pride myself in being a great caregiver and giving my patients the best experience that I can give them, whether that's me teaching mom, again, about how to breastfeed, or like recently when I was at the assignment, I had the opportunity to do a lot of bathing babies. And I recall giving this baby his first bath, and the parents, so when you give the baby a first bath, it's a good teaching moment for you to teach parents, especially if it's their first baby, how to give this baby a bath. That can be intimidating for parents because you got this tiny little baby, you putting them in water, or, you just don't want to break them. A lot of parents feel like they're going to break that new little baby. And I always tell my parents, you're not going to break this baby. But I think that they all have that fear, especially if it's your first baby. You're like, I don't know what I'm doing. Somebody help me. And so I recall giving this baby his first bath, and the parents were just looking like, wow, like, you did that so well. Like, can we take you home with us? Because he enjoyed the bath, and like, he was just so comfortable looking, and you just did that so well. But that's because it's something that I like to do. And again, it's a great time for me to teach these parents. I always tell my patients, you're going to be taking this baby home with you tomorrow. Let's talk about some things that are going to make you comfortable to help you with this new role that you're in. And so my nurses did not give me that experience. And I wish that my first birth experience was a little bit different, because it really, really did, leave me feeling like that experience was not that great. And on top of that, my daughter and I didn't get to bond that first day or so. Those first couple of hours, those hours are important, believe it or not. Nowadays, we do a lot of skin to skin with mom, even skin to skin with dad. Like, that bonding period is so super important for the baby and the family. I didn't get to bond with my daughter. And so that really does impact that new beginning. So that was one of my regrets. Like, I wish, well, not a regret on my part, but I just wish that my nurses would have taken more time and care and been a lot more patient with me. Now I understand with nursing, we have high patient loads, and it's just not possible for you to spend as much time as you would like to spend with your patients one-on-one, because your call bell's going off. Somebody needs this, somebody else needs that. You got to get your charting done. I realize all those things, but I still think that if you have good time management skills, you can factor in taking the time to teach a new parent or your patient, no matter what the setting is. I can only speak for OB because that's what I do, but you can take the time to teach your patients the things that they're going to need to set them up for success, because they're only in the hospital for a short amount of time. And with something like a new baby, this is a lifetime of things that you have to learn. Wouldn't it be great if you were set up for success from the beginning, and you just build upon those skills that you learned in the hospital? And that's the kind of experience that I hope that I feel like I provide that experience for my patient. And I've gotten great feedback from patients that I have worked with over the years. So I know that I provide a good patient experience, but it is because I didn't get that. And so that's my birth story. Thankfully, it was a happy ending. The pain wasn't as bad as I thought it was going to be the first time. My son, whole other story. I wanted that epidural when I had him. Wanted it. He came within 45 minutes of me going into labor, and it was quite painful. That experience, my nurses, because I had him like I said, within an hour of arriving at the hospital, my labor nurses really didn't do much for me because I came in and delivered. I didn't even get a chance to get an IV or prepped or anything for that delivery. And then on the postpartum side, I guess they did a lot more teaching. I delivered at a different hospital the second time, so there was a lactation consultant there. That was another thing. I didn't breastfeed my daughter, and although they asked me did I want to breast or bottle feed, nobody really encouraged me to breastfeed. And I guess back then, I had her in 1993, I guess breastfeeding wasn't a hot button issue as it is now. Like, now we practice a lot of breast is best kind of teaching. And I'm a breastfeeding advocate for anyone who wants to breastfeed. I breastfed my second child for a year, and so I'm team breastfeeding all the way. But if you want to bottle feed your baby, I'm not opposed to that either. I always tell my patients, as long as the baby eats, that's what's important to me. I recently did an assignment at a hospital that was baby friendly, which means they are breastfeeding advocates, and they want all of their patients to breastfeed, which for a patient who doesn't want to breastfeed, that adds on a different layer of stress. But that's a whole separate video. But yeah, I feel like my second child, there was a lactation consultant who was very helpful. My postpartum nurses were a little bit more attentive. So maybe it was the hospital I delivered at. I don't know. But I do know that I will never forget. People will forget your name, but they will never forget how you treated them. And that is 100% true, because even 26 years later, I remember how mean and uncaring she was as a nurse. So nurses, future nurses, student nurses, if you're watching this video, always remember that people may not remember your name, but they are definitely going to remember how you treated them. All right. I Thank you guys for watching. Please like, share, and subscribe. Hit that notification bell so you never miss another video from the Know It All Nurse channel. And I will see you guys on the next one. Peace out.